I think the most dramatic finding is the sudden onset of weakness of one or more limbs. And that is not a subtle or minor presentation. It's an arm or a leg that suddenly becomes very weak and can't be used normally. And so that would be something that would really alert a parent and a child old enough to communicate to that there really is a problem and they need to be evaluated. Other associated symptoms could include some fever or headache or stiff neck. I don't think parents should have undue concern right now. It's good to become informed about things that are going on nationally and potentially impacting our community, like AFM. But cases are very rare, about 1 per million in the US. And so although it's important to know the signs, as we've talked about, I don't think parents need to be particularly concerned.
There's absolutely no data to suggest that any vaccine that we have is associated with this condition. And clearly, vaccination is your best way to prevent certain diseases. Again, we don't know the cause of AFM. Appears to be maybe due to some other types of viruses, but there's some hypothesis that it could be related to underlying immunologic makeup of patients and their response to certain stressors. So there's a lot of things we don't understand about this, but there's absolutely nothing to suggest that parents shouldn't be vaccinating their children. The other thing to understand about this is that some of the cases that have been followed longitudinally do appear to have longer-term sequelae, meaning that some of these children have remained paralyzed for the follow-up period of sometimes years. On the other hand, other kids recover completely. So it's a mysterious disease, very rare, and there's a lot that we yet don't understand about this.